So like we always do, please accept okay, and we're going to get going. And before I do the screen share, I'm really excited about our two guests today, Anna Leggett and Priyanka Pradhan, and she's a doctor. And Anna and Priyanka co-wrote a book, which is honestly, not only did it bring tears to my eyes because I felt like I was living through her experiences via my daughter again, but also because of the sincerity and the just great roadway together that they're able to share and distill down for us all in this community in order to get better. So let me give you the formal introductions. Anna is a wife and a home educating mom to 3 children, and she lives in Suffolk, UK. She is a part-time, part qualified counselor and certified coach. I believe a life coach, right, Anna?
Yeah, life coach, yes.
Yeah. And you've co-authored this book, which is Understanding and Living Well with Post Concussive Syndrome. She writes regular podcasts about her concussion recovery, and she does a wonderful YouTube channel as well, which I'd like everybody to join. In November of 2016, Anna's life, like all of us, was turned upside down from a car accident. During her recovery, she became fascinated with the mind-body connection, the neuroplasticity of the brain, and how to optimize mental and physical well-being. And now this is what she is going to be sharing with others. And for Dr. Priyanka, she is, let me pull it up, Priyanka, a consultant clinical neuropsychologist. She has over 20 years of experience in the field of neurology and physical health. She works currently within the NHS, which I'm not sure what that stands for. National Health Service, maybe?
Yeah.
Okay. And as well as the private sector for neuropsychology services in the UK. Her specialist areas are traumatic brain injury, movement disorders, and neurodegenerative conditions. Along with these specialties and her neuropsychological assessments, Dr. Pradhan offers treatment packages for individuals, couples, and groups that live and work living with neurological conditions. And she draws upon this host of neurological conditions from a variety of psychological therapeutic approaches and models. For example, CBT, cognitive behavior therapy, ACT, CFT, EBMA, which I don't even know what that means, but she will explain it to us. Dr. Pradhan is also a qualified yoga teacher and is her final year of training biodynamic cranial sacral therapy, which is amazing if anybody has not had it. And her clinical approach is to draw upon the aspects of all individuals. And as we know, this is a unique condition, using their mind, brain, body, and spirit in order to provide and truly bespoke and trauma-informed interventions that are rooted in the latest neuroscientific knowledge. So with no further ado, I just want to say Anna and I met via Instagram, and she was so gracious enough to have me as one of her guests for her podcast, and going back and forth in that manner is how I really got to know her and the shared experiences. And so I truly am honored to call her my friend, and they've done an incredible book. I was telling everybody at the conference, which was neuromodulation and rehabilitation, that I was attending and presenting at, how they need to, pay attention and, log into our webinar as well. So I will let the ladies do a brief introduction. I'm going to do a share screen as well so we can get started, and then we can do our kickoff. Right.
Thank you, Lynn, for the intro. Thanks very much.
And yeah, thanks again, Lynn, for inviting us. It's an absolute honour and pleasure to be here and to talk to your community. And we feel really humbled by all your lovely comments about the book. And our main aim for Anna and I was just to get the message out there and do it from each side of our perspective, from the kind of professional and the lived experience. So I really hope that we haven't got long, so obviously won't be going through the whole book, but just a few little topics, few little things that we think are probably important to get out there. And obviously there's much more detail with book. So I've just we've just pulled it together, a few little slides about what we found important in the messages. So we can go to the next slide. I think the important thing from a sort of a neuropsychological and sort of medical field perspective is that not everybody that has and experiences an injury, be it to their head or a whiplash injury, will necessarily go on to have persistent symptoms. And I think this little slide just shows that within, for hours that protective inflammation coming for a good outcome, neurogenesis. So the brain and the body is equipped and wants to heal and wants to, work towards a good outcome. But unfortunately, in some, small but significant amount of cases, the outcome is different. And we know that because of a variety of things, which I'll just briefly touch upon, that, a not good outcome is often when there is some axonal injury, or there's been some blood-brain barrier damage, or, there's a difference in the outcome. So from my perspective, it's always been a case of, as I've developmentally gone through my career, that there's been a time where perhaps those, and this is in the UK, of course, those that perhaps had a bad outcome because they were compared to those that didn't have a bad outcome, and maybe thought that, perhaps their symptoms aren't real, or perhaps there's another cause of symptoms other than the injury. Of course, the more people I saw, I realized that what they were coming to me with were very similar, a range of physical, psychological, emotional, and behavioral changes that I had no other explanation but for the injury that happened to them. So you can go into the next slide. So just thinking about the role of other factors as well in outcomes. So it's not just about the injury, but sometimes around the circumstances of the injury. And Anna writes really beautifully about how the circumstance around them, the feelings that happened, ultimately, usually the injury is within a quite traumatic circumstance. It's in a situation where maybe there's threat to life, or, you have your, maybe, children with you, and there's a threat to them. So there's a lot of other variables and factors. It's not just about the injury. And as we know from the sports world, if there's lots of other injury beforehand, that people can do okay. They can have maybe a few head injuries, subconcussive injuries, but then actually there's one that has the massive impact. So, and for some people, maybe they've been in a few car accidents and everything, they've recovered and had injury, but then they have another one, and then the effects are, really significant. Other issues like other health conditions. So we know that, autoimmune disorders, and something that's coming more into research is Ehlers-Danlos syndrome. So that one of the issues around there is about hypermobility. So something about kind of maybe weaker connective issues, especially if there's been a whiplash injury, and reduced kind of neck strength and stability. Other issues around kind of biological differences in males and females. So, again, from a sort of looking at hormones, and there's more research looking at maybe where an individual, female, was in their menstrual cycle, and we're finding that certain phases of the menstrual cycle, women are maybe more prone to injury, or less, their hormone balances equip them less for recovery. And also females generally, and it's massive generalization, have maybe not as robust kind of connective tissue, and there's some research that the white matter is slightly thinner. So if they've had a diffuse axonal injury where there's been acceleration, deceleration, their brain is fundamentally biologically perhaps more vulnerable. Pre-existing dysregulation of the nervous system. So that's for we are living in a very frantic, full-on world, and we all come to where we are with a range of histories, a range of things that we've had to cope with and deal with in our lives. So there's something about how maybe previous experiences that maybe affected how your nervous system is regulated. Then you have this injury that then expedites or makes things even kind of 10 times worse. And then socioeconomic factors. We know that people from different socioeconomic backgrounds with perhaps less resources have less, are maybe more prone to injury, but also have less ability to maybe overcome, or less access to treatments. So that's just something to think about as well, and maybe something more for health professionals to really be aware of. and also something about rules of living. You know, how do we as individuals respond to having an injury? How do we cope with perhaps being out of, you know, a change of function? What do we do? Do we try and go back to how things were before? Do we allow ourselves time for, you know, recovery? But just a few things to maybe think about in terms of other factors, in terms of outcome. And just to say that, you know, an injury, whatever level, I'm going to the next slide, you know, causes stress on a physical, on a psychological, and biological kind of hormonal level. And this is just a brief, you know, any stress, any trauma, that shows how that then activates certain areas with our brain and then impacts on how our nervous system responds. And of course, we know that our nervous system has two main branches: the sympathetic, which is fight or flight, and the parasympathetic, which is the more rest and digest branch. So just a little highlight of that. And we'll just go on to the next slide. And something we talk about in the book is about polyvagal theory. And of course, this is a theory of around how our nervous system has evolved and how we respond to different things in our environment, be that you know, something that happens directly to us, or, you know, human relationships. And the sympathetic activation is one of mobilization. It kind of gets us to you know, respond. It gets us to react. And often, you know, for example, if somebody's had an injury or a car accident, and maybe, you know, they come out and they're kind of wanting to maybe, you know, fight or understand, or they perhaps become you know, they want to sort of do something about it, but then other people may be more in shock, so then we go into shutdown, collapse. But very rarely after that initial period are people in the social engagement system. But there's a lovely video from Peter Levine where he talks about his experience of being in a car accident, how he managed using his knowledge to down-regulate his nervous system in that period of immense stress. And I think it's really important to think about those early, that just after the injury, you know, what do you do? How do people around you respond? What's going on? Is very important, you know, as carers and parents and loved ones, to think about that. Would you like to add anything there, Lynn or Anna?
I'll just say something, Priyanka, really quickly, because you taught me about this when I was being treated by you, and this polyvagal theory is just so fascinating, and it's something that I still use in my day-to-day life, because I was in this sympathetic mode for so long. Like, I think it was the accident, it was the injury, it was then the stress of trying to find the right treatment, it was dealing with a legal case, it was everything. And I could not get out of this fight or flight state. And even today, I go into it a lot more quickly, and I find myself, you know, dealing with sort of anxious feelings and things. And I'm sure it's, you know, there is this injury part. And you know, maybe you just get used to it as well. Perhaps you just end up in that state for so long, it's then hard to get out of it. I also find myself, you know, have found myself in shutdown, collapse as well. And I just felt I was at these extremes. And so learning about this ventral vagal place to get back to, this sort of where you feel calm and kind of all is well with the world. You know, I'm a lot of the things we talk about in the book and that I talk about are my journey to sort of try and get back to this state. And everybody's up and down all day long, but I think when you've had an injury, it's just these much more extremes, and it's then just harder to get into that ventral vagal state. But there are so many things you can do, and I think that's the great thing. That's what I learned and you taught me, and I'm sure some of people listening here know this, but there are so many things that you can be doing to help, and it really does help. So
and I do want to kind of add in, because I think it's important to like really talk about what you went through, Anna, because you went through from doctor to doctor to doctor. Like even at the accident, as you write in the book, you're like saying things that you cannot even recall nor remember, and reliving the experience. Yeah. So even until you got to this point with Dr. Pradhan, you were almost experiencing the whole thing over and over and over again. And I think this is one of the common problems we have in the traumatic brain injury and acquired brain injury space, is that we're continually reliving it because it takes us umpteen times to find some kind of a clinician to get us to that next step, right? And being able to piece that together, and that's where the beauty of your book comes in, is it's like a roadmap. So I wanted to cue that up for everybody. Anna did not have this straight trajectory of getting better. Oh my God. If anything, she went way down for quite some time and then bounced back and forth and then slowly came out. And to her point, which I think everybody experiences, there are things that you have to learn how to manage and deal with at a completely different level now, and have your own self-help things, your toolkit in place. So I just want to make sure people understand the real journey, what you had.
And that's a great summary. Thank you, Lynn. Yeah.
Thank you both. Yeah, I mean, there's so much to say about this, and I think what Anna said is just perfect in terms of how just the whole scenario, not just the injury, which is activating your nervous system because it's been traumatized. There's the, you know, the environment and what you're having to manage on a day-to-day, which is essentially kind of fighting to get other people to understand and get you know, health professionals and get input. Thank you. So we can go into the next one. So again, you know, these are just really kind of brief overviews around, you know, how do we respond when we've had a, you know, threat to our survival, which is then ongoing for many people after the injury, because there's a change in how your memory works, how your vision works, how your balance works. And all this is a threat to who you are. And so maybe, you know, often people talk about their view of themselves and others in the world has changed. You know, maybe thoughts around the world is not a safe place anymore. And then how does that affect how we, you know, interact with the world and others? And then sometimes avoidance, and we all know that avoidance is, you know, really great in the short term, but over the long term creates bigger issues. Thanks, Lynn. And we can just briefly go on to the next slide. I will have to click a few times, I think, with this one. It's layered, sorry. So this is just about, you know, we're all individuals. You know, we all come with beliefs and attitudes, you know, our education, our cultural context, what we like doing, our personality, and then, you know, something happens. And then, of course, this impacts on our nervous system, our physical ability, our emotion and mood, our ability to think, our ability to, you know, solve problems, to respond, to process information, also how we interact with others. And that's where I think the polyvagal theory comes in as well. And of course, we know that then all this impacts on our sense of self. Who are we in the world? Has that changed since the injury? And yeah, so that this is just a brief, I think you have to click again then a few times to get it all up because it's layered. And then that's where I came in about the kind of holistic intervention is to pay attention to all parts of somebody, what they come with and what they're experiencing afterwards. Thanks.
I have to add in, I just want to make a comment here, everyone. So I'm at the American Society of Neurorehabilitation meeting, and all but ourselves and one other clinician has presented a very siloed topic. For example, only one doctor got up and said, we think there's some kind of relationship between neuromodulation and pain level. And that's all that they were connecting together. But as you are looking at and listening to Dr. Pradhan about this interconnectivity, and I was really kind of disappointed, to be honest with you, that these are the MDs and the PhDs all presenting, and they're very isolated in their siloed thinking, their thought process. And when it comes to brains, and this was a heavier stroke conference than it was brain injury, but they were only looking at if A, then B. They weren't looking at the whole picture. And I think this is just beautiful about what really is going on and how, as patients and caregivers, we really have to educate the practitioners. So I wanted to point that out, that the mindset of most clinicians are not robust like this, and we've all experienced it.
And and I think sometimes it's very symptom orientated. So if you've got headaches, then you'll have treatment for headaches, but of course maybe not understanding what are the things that trigger the headaches, or understanding how to manage them more, rather than just medication, how to manage them more holistically. And just a brief one to pay attention on the next slide, just to the concept of the window of tolerance. And whilst this is derived from the trauma world, I use it quite a lot in terms of having my clients and patients understand how to maybe work within, and like a graded, maybe expanding the window of tolerance after an injury in a really slow and nurtured way, rather than what I've experienced a lot with mainly kind of young women actually, is that they're told that they're fine, so then they just go back to what they were doing before, and that's when their symptoms actually get worse, and that's when the impact of the injury is bigger. So for me, and working with individuals, is about how do you just not let yourself go into that kind of hyper-arousal stage or hypo-arousal, but keeping within this window of tolerance. And I really like it as a model. It's Daniel Siegel, who's an American neuroscientist, who's brought this. So it's about the more that you can expand your window of tolerance, the more that you can withstand things. So immediately, I think after the injury is quite small, and then working with good clinicians and yourself to expand it. Next, so this just means about regulation. So it doesn't mean calm. Regulation means staying present in your body and connected to yourself. We know that past trauma already, so if you've got some past trauma before an injury, then your window of tolerance is actually smaller. And that means that we go into anxiety and shut down quicker. Also, maybe, there's lots of emotions that come with injury, loss, grief, anger, being, aware of all the emotions that come up. And, just being more connected to our bodies. Where are these feelings? Where are they stored? Where are we experiencing them? And how do we increase our tolerance to these different sensations and feelings in our bodies? And then just the last step, which is just, a kind of little, some tips that, they're not totally comprehensive, but just some things to think about just as we finish. So allow, and I invite Anna in for this one. I mean, these are just a few things that I think are really important, but I really welcome what Anna thinks as well. So allowing time for rest and recovery, focus on the basics: food, hydration, sleep, and movement in a really, gentle way. Managing your and other people's expectations. I'm going to talk a lot about that issue. And finding treatments that are right for you. So, physical, emotional, and spiritual, looking at the whole of you. Understanding your triggers to symptom flare up, and for that needs tracking of symptoms and situations and environments and what you're doing. It requires that. Maybe exploring how pre-injury patterns or behaviors or rules for living may be affecting your post-injury life. Was it that you worked 100 miles an hour beforehand, and that's really hard to then readjust post-injury, or that's just an example. And then bringing in calm, peace, nourishment, and connection, I think, is just a really core element of this. So that's the end of it, what I have to say for now. So I'd really invite Anna and Lynn if there's anything else you want to add to that.
Yeah, I think that's such a great, you've put that all really succinctly, Priyanka, and it's a great summary. And I totally agree, these top tips, they are the top tips, really. And I think be really encouraged that the basic things, when you get the basics, when you pay attention to the basics, things really do happen. So that thing of, food, sleep, hydration, movement, they're really critical. And again, I think it's I know for me, I felt when I'd had my brain injury, I just thought I felt really helpless. I felt like there's nothing I can do. And I was just looking to doctors all the time to give me answers. And so many of them couldn't give me answers. But I think it was that realization that there's a lot I could actually do myself, that I had control over. And those are certainly some things that, we do have control over. And, just live a really healthy lifestyle. I just tried to be as healthy as I could, and I did a lot of research around it, but those things really do make a difference. And then Priyanka was saying about the window of tolerance. That's really important as well. She taught me that. And it's just that thing of kind of doing things within what's kind of comfortable for you, like not stressing your system out too much, whether that's exercise or like trying to do too many treatments at once. So kind of stay within what's kind of comfortable for you, but you do have to push as well to the next level, but you want to go really gently. You don't want to overdo it, because then when you overdo it, you get that horrible kickback, and then that, you could be out for days on end. And that just takes time to get used to that. And, you'll get it wrong sometimes, but just don't let a setback floor you completely and really take you out or take you down, because you gradually, it's weird, you kind of gradually inch forwards and go back a bit, but then you keep going forwards. So yeah.
I
So,
use the term, just symptom takedown, that thing when you've done too much and then there's a big symptom kind of takedown, and then and actually the disappointment that comes with that for people, and that's what I want to help people avoid, really.
So I think the book illuminates that a lot. So I'd like to kind of talk about that a little bit, Anna, because you write in the book. So the book has two voices. It has Anna's experience and what she was going through, and then it is combined chapter by chapter with Dr. Pradhan of the therapies and why this therapy at this time was really instrumental to get Anna to that next level. But Anna knew who she was, just like everybody else. And when you sit there, and we've had this conversation before, as the caregiver, I would sit there and I would try to understand, what is it like for my daughter to wake up a different person? And it's really hard to reckon that. And so I think, Anna, maybe kind of speak to that a little, about how that was a big burden and you got through it, and some tips and tricks for that as well.
So do you mean in terms of like feeling different, like for the person? Do you mean for the actual individual or for the caregiver?
For the actual individual, yeah.
Yeah, I think unless you've had a brain injury, you can't. It's very hard to explain. It's very hard to understand. And I really honor you, Lynn, for and Priyanka, for trying to work with people like us, because it's not easy and it's complex. And Lynn, for you, for supporting your daughters and trying to empathize and trying to get in their heads. And that's so wonderful. And I think if we have supportive people around us, that really helps, because my identity felt completely, I just felt like a different person. I felt like an alien had invaded my body. I didn't feel like me. I was like, and I didn't like the person that I was. I just couldn't do the things I could do. I felt embarrassed, a lot of shame, like I felt people were looking at me funny, like I was acting funny. And I want to behave in a certain way, and I just wouldn't come across like that. I was clumsy. I would come out with the wrong words. I was very socially aware and socially anxious, and I just felt like such a failure. So it's a horrible feeling, and you kind of know you want to be different, but your brain's just not letting you. Just can't be. And there's so many feelings, and they can be really overwhelming sometimes. But I think it was trying to learn to be kind to myself, and recognize how I was speaking to myself. Like sometimes I'd be so critical. I'd be like, oh, come on, for goodness sake, just sort yourself out. And and I thought, no, that's just not going to work. I need to be kind. I need to be compassionate. I listened to a lady called Tara Brach. I don't know if anyone's ever come across her, but she talks about self-compassion and self-acceptance. And I listened to lots of her sort of YouTube videos and things. So how you talk to yourself, learning to like myself as this person that wasn't me, that I just had to learn to like myself like that, warts and all. That was hard, but it helped. It really did help. And surrounding myself with people who cared about me, I just kind of had to not spend time with people who who didn't understand me, or who made me feel, bad about how I was, or who didn't believe me, because I had that as well. And you can't always avoid people, but you can try and spend, limited time and spend the time with the people who support you. Really, that helps enormously. And gradually, I kind of have got back to much more to who I am. I still have quirks. I still have bad days, but it's just a lot of me did come back. And then I just learned to sort of accept myself with some differences as well. And that's part of the journey. And I don't know if other people can relate to that, but I just share that, put that out there.
I'm sure they can. And please, we're going to open this up. I'm going to answer the question in the chat. So we're going to open this up. So please, everybody, take your mics off. And if you want to be on camera, feel free. I want you all to know this was a true labor of love from Anna's perspective to write. We all know how difficult it can be to put words on the page. And what she just explained to you, she didn't tell you she was a writer before this, and she couldn't find words to put on the paper. And she was committed to making this happen. And it really became a labor of love. And so pushing herself through this journey, like, hats off. Like, I truly bow to what you accomplished. And I mean it. Like, I want to put excerpts of the book up, but I won't be able to because of where I'm at. But we'll continue. So we do have a question in the chat, which is yes, the video is going to be replayed. And the question is it for concussions only? No, the book is for, I think, any brain injury. It's not just concussions. A severe TBI, being hit from an 18-wheeler. I'm still trying to understand my TBI and the things that come with it. She doesn't have any memory at the time of being at the trauma center or even in the rehab. And she did get some help in North Carolina. So I guess what the question might be for Lisa is, how does she get through maybe that emotional or that memory part? Is that what you're asking, Lisa?
Yes, ma'am. I don't have any memory at all, and it's going on 3 years, and I know I'm different, but I have no memory of going through anything. If it wasn't for my daughter being there, I wouldn't even know how to take care of myself, because there was no follow-up at all in Savannah. In fact, I had to get my medical records, or somebody in my family did, that we even knew what happened, how severely I was injured. I rested. The neurosurgeon stated that if I lived, I would be comatose or a vegetable. And obviously I'm neither of those. I'm very blessed. I know that. But, my parents are 80 and 81. Oh, wait a minute, 81 and 82, I'm sorry. And I was with them. For a while, they didn't understand me. And I couldn't explain what I was going through. I had no way of understanding it. Like, they hurt my feelings and I couldn't express that. So, like I said, I'm just trying to understand, is this normal? By the way, I'm sorry, Miss Lake, what's the name of your book as well?
We're going to put it up at the end, but it's Living Well with Post Concussive Syndrome.
Okay.
Yeah,
Thank you.
But I'll put a picture, and it will also go out in the follow-up email. So I guess, Priyanka, how can she help with the memories, and how, Anna, can she help with getting people to understand?
I mean, Lisa, thanks for your question, and I'm really sorry that you've been through quite an amazing and traumatic injury. And usually when the brain has suffered such a significant injury, and the reason why we call this book Post Concussive Syndrome, because it is for those at the milder end, which are not often seen on scans, and therefore they solve the kind of the issues around that. For somebody like you with a really significant and severe injury, which is probably not always but shown up on a scan, often the brain will, as a protective biological thing, not have any memory of it, because within that injury is kind of shut down. It's just gone into survival. And at that point, remembering what's gone on is not necessarily what it needs. It's, you know, superfluous. And it may not be that your brain, you cognitively remember, but your body is probably likely to remember. And it's probably that, you know, that we know about implicit memory is a really, you know, there's different types of memory. There's a memory that we can pull into our, you know, our heads, you know, what we had for breakfast this morning or what we did last week. But then we also have implicit memory, which is more kind of an emotionally based memory where we have a feeling or a sense. So my sense is when I work with people, when I do work with people with severe brain injury, so they don't have any memory of it, this is really it can be quite disconcerting. I understand that. But sometimes the focus on trying to get the memory may distract you from the kind of recovery journey and looking at all the things that you've achieved and you've managed despite the significant injury.
I agree. I think, yeah, I agree with that, Priyanka. And I think that it was really odd because, I mean, my injury wasn't as severe as yours, but Lisa, but I did lose some memories, and I think part of this is this protective thing. As you heal, if you find the right people to support you, I mean, I would say find someone like Priyanka, someone you can talk to if you haven't been able to already, or find supportive people, because as you process what's happened to you, you come more out of the fight or flight, and the more you can go into that kind of the where feeling like everything's okay, like you feel safe, right? You'll find some of the memories will come back. Some memories, I mean, I don't know about around the trauma that might have gone, I don't know, but of who you are and like your identity and everything. And also I've found like just doing things that I loved, doing things that I enjoyed, that gave me joy, that gave me good feelings. The more I did those things, the more I've sort of healed, and the more memories did sort of come back. And, you know, I looked at photos, I would reminisce over things. And I think there is a part of you that's protecting you somehow. And it almost doesn't feel safe to be happy or to sort of come out. But as you do, some of the memories I hope will come back. You may have lost some, and you know, that is hard. That is hard to deal with. But I think, like Priyanka said, focus on what you do have and focus on some of the other things and really healing. But it takes time and it's a process. Yeah.
And I will say Lisa's case was pretty severe. Like the physical traumas were clearly being hit by a semi tractor trailer is obviously no joke. One of the things that I can say, again, coming from the caregiver side, I tried everything to help my daughter have the memory of what happened. And we tried hypnosis. We tried all these deep, I forget what they're called. Like I was grasping at straws, right? Because I thought if we knew, maybe we could get better. Maybe we're missing something. But Anna's right. There has to be a safe space when you finally come to terms with that is just what happened, right? In this void of a space, and I need to move forward. And how do I move forward and start to do things that support me and help me and I like and things like that. So, oh boy, autoimmune disease plagues Lisa as well as chemo infusion. And I don't know, do we have brain fog issues when we have chemo infusions? I mean, that's a possibility as well.
You do. Bad.
Lisa, I think you've done incredibly well to get to where you are. I mean, you shared your prognosis and it was pretty dire, and you're here talking to us on this webinar. I think you've done incredibly well.
Thank you. My Glasgow scale was a 3.
Yeah, so that's
That's like one of the worst, I think.
Yeah.
But again, I'm blessed. I'm here.
Thank you for sharing that. Is there another question? Does anybody else have another question for Anna or Dr. Pradhan?
You can call me Priyanka, Lynn.
Okay, this is the quietest the group has ever been. Hi, Sharon. I haven't seen you in a while. How are you?
Oh, I should not be on camera, but I am.
Oh, no.
It's nice to see you. This was fabulous, fabulous, fabulous. And thank you to both. I think I had a traumatic brain injury, in the middle of in the middle of family litigation. So I thought that one of the things that you said about being not in your best mode, is that a kind way to say it? When all hell has broken loose in your life, and then you have a major fall. I fell off a ladder and was not diagnosed for 5 years. But I think trying to find therapies and, you know, understanding, you understand. I mean, you know, Priyanka, and I shouldn't say Priyanka because I can't pronounce Dr. Pradhan. I mean,
Priyanka.
Your heart and soul is in this, and you can see. I've had lots of treatments, and I find the putting it all together is just incredibly difficult. And maybe it's different in the British system, but I'm sure it's just as bad there. But what would be your kind of advice to sort of navigate all the different therapies and so that they work together? Does that make sense?
Yeah. And I think, you know, both Lynn and Anna Anna can probably speak to this better than me in terms of her experience of what she tried and where she saw help. And I think, yeah, probably from my perspective is about finding something that's right for you, because it's not a one size fits all. But as long as you kind of look at the different aspects of yourself and try and meet something, so physically, you know, cognitively and emotionally, how do you find treatments that help with these? But the first thing is about getting into a place of safety. But obviously, if you've been delayed diagnosed, that's you can't do that straight away because you don't know what's happening. So again, you know, it's again amazing journey, and that's what everybody has, such amazing journeys that I'm humbled by. But yeah, I'll let Anna speak to that question too.
Yes, Sharon. I would ask, what has worked for you? What's working?
So I would say craniosacral therapy worked wonderfully. Some cognitive therapy worked wonderfully. Being able to do things physically was terrific, but I've had to pull back from that. And I think I used to play tennis, and I can't because I have a vestibular disorder, and I would fall. So I can't do that. And I guess, you know, what you're saying, it's so comforting this is within my reach. And, you know, I need to be able to embrace this all together. I mean, does that make sense?
Yeah,
But I
yeah,
think
it does.
it's hard to do alone.
It is very hard to do alone. Have you got some support? Like,
it's a balance. It's difficult.
okay.
But
So,
I think you've given me hope.
oh,
So
well, that's good. We wrote the book to give hope. We wrote the book to give hope. We really did. It's very, very hard. It is.
Yeah.
I mean, you're so brave and you're so courageous. It is. It is. Yeah. It is, I can't remember what I described it as, a brain injury. I mean, it's just hard. It's very hard. But you know, you're doing great. You found some things that work. Have you had was the vestibular disorder as a result of the head injury?
No, it was.
Did you have that previously?
No, I had it after the brain injury. Then I fell playing tennis. And so I fell like 4 times, and I fell hard. And then you know, there is a vestibular. So I've had treatment. It's worked.
Okay.
But I'm not, you know, I'm not back to being my physical being. And I miss that.
Absolutely. And I would say I had mine gave me a vestibular disorder as well. And the treatment really helped. It was such a game changer. That's why I was going to say, if you haven't had it treated, please get that treated. And I was given balance exercises and all sorts of things. Now Priyanka, I'm not quite fully restored either physically, but I am, I've come an awfully long way. But Priyanka got me to she worked so closely with me. I think you need to feel really understood by, your, like, either a caregiver or a professional, a neuropsychologist. If you can find a good one who gets brain injury, they've got to get brain injury. You need someone who knows brain injury. Keep looking for them if you haven't found someone, but if you've got someone, that's great. So that support is really, really helpful. So Priyanka put me on to somebody. He's called he does this thing called Movingness. Peter Apple, I mentioned him in the book, actually. I mean, he's just one person. But there are other people doing this kind of movement practices. Anything where you're not going to overstress your nervous system. So if you try and play tennis, like, off the bat kind of thing, it's too much. It's just going to overwhelm your system. And so I started doing these incredibly gentle exercises. I've been doing Pilates, I've been doing various things, but it would just put me out for a day or two afterwards. It was too much. It was just overwhelming my system. And so these very, very gentle movements of kind of just turning my head from side to side, or, if you can find somebody who can help you with those kind of very gentle exercises, it does. And then it's this thing of safety. It's telling your nervous system it's safe. You're not overwhelming, and then it's not kind of shutting down because it's too much and it's feeling threatened. So it's this very much this thing of always trying to create safety in whatever you're doing, and then gradually get this expansion. And yeah, that was my experience anyway.
That's a good point. Go ahead.
And the Dana does some exercises around kind of polyvagal, so kind of increasing your vagal tone a bit around the Stephen Porges stuff. So that's some of that is kind of singing or dancing, or kind of bringing that sense of what's it like to be you again, or what do you really love, or what's your soul need. And I think we forget about all those things that are within our reach as well, and sometimes look for something that is unreachable. So.
Well, I am not here to take over. I think I'm trying to be involved in this community, but this is the first time I've heard a conversation about the polyvagal system and how that affects people with brain injury, including just a concussion, which we need to take the just out of just a concussion. But it isn't discussed often.
So
am I right?
Sharon, no, you're 100% right. So
I don't need to be right, but
no, but you are. So, to Anna's point, it took 4 cognitive behavior therapists or clinical psychologists or whatever kind of therapists they were that I had to take Natalie to before I found one that could really address her PTSD. I thought the first one was a winner because her daughter, a little too drunk on her 21st birthday, going up the stairs, fell back and gave herself a subdural hematoma. And they missed her brain bleeds in the hospital, but she then suffered a big old TBI. And I thought because her mom was this incredible clinical psychologist and was experiencing what I was experiencing with her daughter, it couldn't have been a better match made in heaven. I got to tell you what, this doctor would sit there and say to my daughter, you just go do whatever you want to do. This is your life to live and lead. And I'm like, she can't even walk a straight line. Like, come on, people, let's figure out something else. But it just, that's a little bit of an extreme example. But my point is that it takes a lot of effort. And I know that this is a drain on people with brain injuries, but it takes a lot of effort to find the right therapist to get you to those next levels. And in what combination, when Anna was interviewing me for her podcast and we were talking about Sally, at one point she goes, geez, I wish I could have tracked with Sally while I was doing this. It would have enlightened me so much more. And you guys know how I feel about trying to make sure we have all the data, right? And a message came in about this has to happen across disciplines. And yes, it does. That's what real personalized care is about. But I again, am going to push you to the book. I'm going to put a bit.ly link, which is going to be for the book, but I'm going to also post on the screen, and this will all come in the follow-up email. Anna and Priyanka graciously is giving a 60% discount. I mean, it's like $8, right, for the book. Like, yeah, it's incredible. But it's a resource with all these links and all these places to start rooting through and like, can this help me? Because our brains are Rubik's Cubing and we don't know what to do yet for whom. So, you know, I mean, yeah, no, I think you're right, Sharon. You know that.
Well, you know, I was at a meeting last week regarding in New Jersey, which is where I'm living right now. And it was about, you know, with lots of mental health professionals and how brain injury affects them. And we're, you know, there are many people that are trying, and it just, there's just such a disconnect, and it's difficult.
Mm-hmm.
You know, and there's no straight line in this. And we, you know, and we all want a straight line.
Yeah, yeah, we do. We do. I will say this, and Jeff, your pictures are unbelievable that you put in the chat, like talk about a survivor. And I know I've heard of the cognitive FX. So maybe you could speak about that to the group to kind of give everybody some idea about what you experienced. You're on mute.
I was going to chime in and say I'm new to the traumatic brain injury community. My accident happened May 19th, 2019. I spent a year at Shepherd Center and then 2 different therapy homes learning life again. But I think what I've gained the most from is community. We thrive in community as far as we can feed off each other, because odds are when you bring it up to the group, somebody else has traveled that path. Now, they may not give you the perfect way to work through it, but they'll give you a place to start, where if you're just out in public with average Joe or Sally and you talk about your deficit, they're going to look at you like, what is wrong with you? And you're like, yeah. So I think the biggest thing, and I'm so grateful we have these groups and these Zoom that we can meet, because being in community is the best, one of the best therapies, because you learn so much from each other, and we provide each other inspiration. Because if you told average Joe or Sally that, yeah, I remember to set an alarm for a meeting today, they're like, yeah, okay. But to us, we know that took a lot of time and effort, that you had to cognitively think, oh yeah, I need to put a reminder in because I got a call at 3 o'clock. And we will pat each other on the back and say, good job. So I'm very grateful that you guys, and we have this community, because in my short time now being in the traumatic brain injury, and I say, I don't say survivor anymore. I'm a warrior. We're not survivors, we're warriors. That old word of TBI survivor, I don't like it. I like warrior. Warrior
I'm
sounds
with you.
better.
I'm with you. Yeah.
Yeah, because we're more than survivors. We're warriors. We looked at TBI in the face and said, nah, not today, buddy. Not on my watch. So I think what you guys offer in this community is amazing, because we can pull from each other. Because odds are when you bring up something, a deficit of yours, somebody else has already ventured down that road, and they'll at least get you started in the path that'll help you overcome. And that, with that, I also am learning that with a TBI, you're like an airplane. You're either taking off or there's never a cruising altitude. You're either constantly seeking more therapy to build back, or you're going down. You'll never go, oh, I'm here, I'm just going to hang out. No, you won't. You'll go down faster than you went up. So I would tell everybody else, don't be afraid to ask for more therapy, because you can never, and I'm very blessed that I live here in Chattanooga, and I have Siskin physical rehabilitation hospital. And every time I go in there with something, I think, oh man, they're like, oh, we got a program for that. I'm like, you do? Like vestibular. When they told me my vestibular was wrecked, I'm like, V is a vein. I'm like, y'all did surgery? And then they said, no, it's the crystals in your ears. And I go,
Yeah.
wait, y'all put crystals in my ears? I knew y'all did some surgery, but man, I didn't know y'all put crystals in my ears. So anybody out there, if you're needing a good place to go get therapy and you're near Chattanooga, or you can come to Chattanooga, Siskin Rehabilitation Hospital is a great place that will help rebuild you back. Sorry, I got long-winded.
No,
You
No,
might have
that's
told,
so great,
you might have
Jeff.
been able to tell I
Yeah,
was a
lovely.
salesman before
And Jeff, you've got, your attitude and your approach to things, that positivity will really carry you through. And, it is an up and down journey, and you'll go through, it's an emotional roller coaster ride. But if you can build kind of resilience into yourself, if you can, I don't mean just being positive for the sake of positive, but I mean
Right.
develop a sort of positive attitude. It will really, really, really help. And it's a marathon. It's not a sprint. It takes time, this journey. And you're right. You have to work on one thing and then another thing and then another thing, and it can feel very overwhelming sometimes. But if you keep going, you will keep getting better. You will just keep getting better. And you might reach a plateau sometimes. You might reach a plateau in one area. We'll try something else. And if you think like a baby trying to walk, I put this in the book, they don't just get up and walk. It takes a very long time. They've got to go through the crawl, they go on their tummies, then they crawl, then they stand up, they fall over a lot, but they never stop. They just keep going. And we have to do that as adults with this brain injury thing. But you honestly, I didn't think I'd be able to read properly again. I never thought I'd be able to write a book. It's crazy that I've written a book, but it just shows, and it wasn't easy, and it took me longer, and I've had all sorts of frustrations along the way, but I promise you, so much is possible. And do what you love. Just really, really, really do lots of things that you enjoy doing, because that A, gives you joy, and B, you'll see results. You'll make some progress, and keep giving yourself pats on the back, and keep giving each other pats on the back, and really celebrate your every day, your little things, like you say, like setting an alarm that's brilliant. Celebrate that. And you're right, average Joe won't get that, but
Yep.
anyone who's had a brain injury totally gets the significance of that, and how amazing, what a great thing that is to celebrate. So keep doing that, guys, seriously.
Yeah, I've learned to set this. Before my injury, you set big goals, now I've learned to set lots of little ones that you can obtain and that make you get to there's stairs.
Exactly.
Instead of trying to climb the mountain in one step, look at it as in stairs and go, okay, this week I gotta get up this flight of stairs, next week this flight of stairs, and eventually I'll get to the top of the mountain. But don't look at the mountain and think, oh, I gotta get there today, because it's not that easy. But if you set little goals, it'll give you something to build on, and when you accomplish that one, you'll go, oh, I did that. I bet you I can do this, and I can do that. And again, being in our community, don't be afraid if you've done something to speak up about it, because we all are here and we understand that that was a big. So we'll congratulate you, and we'll give you video high fives and tell you great job.
Absolutely.
Because that goes a long ways. Just hearing somebody else say, hey, great job, that makes you go, oh, okay, I did that, I'm good. I'm good today.
And I think also, Jeff, I mean, that's just brilliant and really inspired and really real. And it's about that comparison point as well. I talk to a lot of my clients about, if you are continually comparing yourself to before the injury, then the goal is different. Whereas if you compare yourself to that point just after the injury, and then you see how much you've progressed and developed, it gives a different perspective. And perspective is a big factor in this too.
Yeah, that's the big thing. You hit the nail on the head. Don't look at what I did before my accident. Look at what I've done since the accident, and give yourself grace, because it's, again, we are all TBI warriors, and we've already overcome so much. So don't beat yourself up. Every little step is a step. And as long as you're, whether it's a giant step or a little step, as long as you're stepping, you're moving. And that's all we got to do. Keep moving.
Wonderful. Thank you.
So a couple questions. So I need to clarify. Thank goodness Gracie's here. Thank you, Gracie. So the audiobook is not ready yet, Diane. And I know that you do have trouble reading, but it's one page at a time. That's all you need to read. It's an easy, simple read, one page.
Yeah, or if you
and
can get somebody to read it to you, maybe, if you've got someone who could help read it to you. I would love to do it as an audiobook because you're not the first person who's asked that. So yeah, we'll try and work on that. But it won't be anytime soon, I don't think, unfortunately. But yeah, like Lynn said, a page at a time, or maybe have someone read it, some of it to you.
yeah, and I'm going to do a share screen now, which is if you take the QR code, you can do it right now. However, again, I'm going to send this out. I don't know. Let me see if I can make this really big. This is what the book looks like, which you've seen it in some of the emails that we've sent. But I will send all of this, like I said, so you don't really have to stress and do it right now because we're trying to make it easy for everybody. But should you want to, you can QR code it now. It'll take you right to the link. But this is for the ebook version. I will say this, and Gracie, I don't know if it can or cannot work with this book. Once you purchase an ebook, you can have a reader on a screen read to you. So I don't know if it is or is not prohibitive. For example, we had not a patient, we had a member of Power Patients, and he had a really hard time because his eyelid would close. And so he had a hard time reading. And we found a link where all of our blogs, he just had to push the link and the blog would read for him. So I'm wondering if that's maybe something in a browser, because this was browser specific, not book specific. So something maybe we can help you explore.
Hey, Lynn, also there's something called like a C-reader pen where you just run the pen over the words.
Oh,
I have one of those. You can get them on Amazon, and
okay.
it will read whatever the text is in whatever language you read from.
Oh, neat. Chantel, you've been quiet. I was expecting you to chit chat a little bit more today.
Well, I did want to jump in, but I didn't know how pressed for time we were in, but I wanted to say thank you everyone for sharing. I'm a two-time brain injury survivor. First diagnosed with PCS in 18 after my first injury, and again diagnosed again in 19 after my second injury. And one of the things I learned, and this is piggybacking on what you all were saying, is and this is one of the things not only that I learned, but I also share with other people. I was hospitalized, and I see Cassie's on, she can attest to this, last August for syncope episodes. I would be talking to someone and I would black out or have fainting, dizzy spells. But when you look at some of like post-concussion or concussion syndromes, some of the things I was dealing with, I just thought this was all relative to TBIs. And when I went into the hospital last August, it was the most extensive care, physical care I've received since head injuries. And they were the ones that taught me. Of course, we know you can develop comorbid issues, but that, as we've learned from your head injuries, that produces other things. So I developed neurocardiogenic syncope from the head injuries, and also other challenges as well. And I had to get put on medicine for it. So I felt better than I had felt in years. And one of the things I learned was, because you can get used to the pain. You don't try to, but you get used to the pain, you get used to the symptoms, and sometimes it could develop into even more than what it started with. Like if you're having headaches every day and you're 4 years post-injury, that could be something else going on now that stemmed from that. So the doctors took it very seriously. When I was admitted, I was in the hospital for 3 days. They took it very seriously, and they taught me that, you know, when you deal with PCS and you deal with anything related to the brain, that it could cause something, but that cause and effect could have this ball tumbling down the field for a while. But like you guys, Jeff, I appreciate my experience, what it's taught me, by God's grace, and to the shock of my neurologist, and even looking at my brain specs. I went through Amen Clinic, and I got pictures of my brain. I was able to finish my doctorate post time injury, and it's still a shock. And but it was a blessing, and it was hard. It was hard to keep going. I don't even remember some of the things and that we did. But the Brain Injury Association in Georgia and the Trust Fund Committee, they helped with some of the support and resources that I used to help finish school. Like another resource is, you know, some of the new computers have dictators on them. So you don't have to type. You can just speak it into the computer and it types it right out for you. Or like a C-reader pen, like I had mentioned earlier. And, you know, all these resources. The challenge with people, like we're here on this line, but I've come across so many people that they don't know what an occupational therapist is or a cognitive therapist. They have very little resource, very little information, even knowing how to begin. And as we all know, it can be so overwhelming, even just sitting down to learn it, you know, or understand it. You get a headache after the first 2 sentences, especially if you don't have the support. So I appreciate moments like this, because we know like the whole each one reach one. When we learn something and grow from each other, that helps other people as well. And it helps us, because I have to remind myself when I have what I call TBI episodes, when I do something and then, you know, I realize, okay, you've withdrawn too much from the bank. Now you have to recover 3 days because you wanted to hang out, you know, 8 hours on one day. And that's a no-no, but you were excited to have fun. Now you have to rest your brain for 3 days. And not to get frustrated, just to be
Chantel, you're breaking up really, really bad.
Oh, sorry. Can you hear me any better?
I can.
Yeah, that's fine.
Okay. To just kind of still roll with it. So, like you said, it's an everyday process, and that's what being a warrior is about.
Right. You
Yeah,
had me
absolutely,
nervous,
Chantel.
You said dictator, and I was like, why are we talking about Hitler, Stalin? I'm like, whoa, what happened? This meeting went sideways quickly. She said dictator. I'm just trying to add a little humor. Laughter is
That's so funny.
Laughter's the best medicine.
Yes, it is.
There's such a wealth of experience and knowledge and resource in this group. And yeah, it's about you having that opportunity to share it. And, you know, I think, Lynn, you've created such a, you know, helped to create this community, and you can only build, and know that you're the support for each other, because I know that, you know, people have different levels for support. And if you know that there's one channel of support via this, that's really great.
Yeah, Lynn, it's a beautiful community. Thank you so much for inviting us in here. It's been lovely to be here and to experience this and to see you all supporting one another, and keep doing it, because it is a huge part of recovery, actually. So don't underestimate the value of it. It's really powerful.
Thank you so much for that. I do have to, I somehow got kicked out, but brought back in. I'm not quite sure what happened, but I do have to jump on a plane. And our guests have to go put their children to bed. So I do want to say thank you, you guys. People, I cannot tell you enough. Please consider the book. They, as I said, heavily discounted it. Yeah, it is so powerful. And it will help support you in your journey, like I have been saying. And I'll follow up with the links to the webinar once it downloads and then uploads back up to the cloud. And, you know, use the book and Sally, put them together. And we've got some more stuff coming out. And I think next month we've got Dr. Krishna, and he discovered by using eye drops he can relieve the headaches of TBI patients and get them into vision therapy sooner. And so now we're starting a clinical trial for this as well. And so this is what we're publishing. So it's really exciting. These doctors who are the functional doctors that we all need are figuring out pathways with their patients to accelerate the recovery journey. So, and then the month after that, we have a TBI warrior, not survivor, a warrior who became a chef and nutritionally has been dealing with the inflammation. And you'll learn a lot what restaurants do when they say they're doing something else. Like, her story is incredible. It spoke to me because she was a Division I volleyball player, like my oldest daughter, who also concussed out of volleyball. And she talks about how they tortured her mind in getting her to continue playing when she had no balance, Sharon or Jeff or Chantel or Anna, like the rest of us. And, you know, she was following the orders. And then she had to deal with a whole lot of that monkey chatter in her head. And who was she? So you'll be impressed by both Dr. K and as well as Ellie, and you'll see the book, and we'll just keep going.
Great. Good luck to
All right.
everybody with your continued recoveries.
Thank you. Thank you for taking the time and the
Likewise.
thought to write the book. It's a gift.
It is. It
You're
is.
welcome.
Thank you.
It's a real
Yes.
gift. Thank
It is.
Aw.
All right. Thank you, everybody. And I will see you all soon.
Thank you so much for inviting us. Bye.
travels.
Safe journey,
Okay.
Lynn.
All right.
Bye-bye.
Thank you.
Bye.
Night-night.
Have a nice bye.